all from the health tech space. Hi everyone, welcome again to VCTV. I would like you to do a short introduction about yourself, like which company you represent, what work you're doing in the space to start off with. First, I'd like to go with Shamir.
Thank you, Sonia. Thanks for the quick introduction. I'm Shamir Thaha. I'm the Chief Strategy Officer at Accubits. We are a blockchain and AI engineering firm headquartered in the US. We have quite a few investments of our own as well, and we've been in the healthcare space for a long time now. I personally have been in the tech industry for about close to 15 years. And I'm based out of Dubai at the moment. We've been instrumental in some of the key projects based in Dubai as well as in Singapore. Love to talk more during the discussions.
Sure. Thank you, Shamir. Welcome to VCTV. The next speaker I'd like to go for is Ngan, Manhao. Floor is all yours, Aga.
Thanks, Sonny. Thanks, everyone. Sorry, I just had a bit of an echo. So I am the founder and managing partner of Futuris Solutions and Future Health. Future Solutions really is a health tech advisory. We've been advising health tech companies in Australia and Asia for the last 4 or 5 years. And due to some of the work that we've done and the really interesting entrepreneurs that we've met, we're recently just about to launch our Future Health investment fund, which we're very, very excited about, so that we can play a larger piece in the ecosystem in health tech here in Asia, as well as expand on some of the advisory work that we've done. The work we've worked with, we've taken companies from product development all the way to listing in Australia. We've worked with brick and mortar clinicians and done digital transformations to have an online presence for them. We've done a lot of product design and we've worked in a number of diseases. We've done cardiovascular disease, we've done diabetes, with the purpose of really doing digital transformations for startups to play a bigger part. So very excited to be here tonight. Thank you, Sonny, for inviting us, and look forward to the discussion.
Thank you, Aga. Welcome again. So the next speaker we have is Henry. Over to you. I'd like to start the short introduction, even though I know quite a bit about you already. You unmute.
Okay, sorry about that. I thought someone had to unmute me on my side here. Well, thanks again for having me again, Sonny. Now you become like a family to me now, seeing you so much, basically daily now, right? Good evening, good afternoon, good morning, everyone. Great to be here once again. Henry on here. So I have 2 hats for the most part. I have an advisory firm that mostly focusing on interim CFO work with startups and SMBs. A lot of work dealing with on the areas of finance, strategies, and operations. The second hat that I have, I'm a venture partner for a venture fund, investing in early stage companies. I spent a fair amount of time in fintech, blockchain, consumer, AI, ML, and IoT. I would say recently spending a lot more time in healthcare. It's very exciting. Due to COVID, obviously healthcare has becoming very, healthcare has always been important, but certainly, due to COVID-19, it's certainly bringing to the forefront of things. Excited to be here. Looking forward to learn from other panelists. Looking forward to our conversation and love to share my 2 cents as well. Thanks again for having me.
Thank you, Henry. Thanks for that introduction. Last but not least, we have Richard Satur. Please introduce yourself. Richard, you are on mute.
On mute, sorry, you're right. I did the same thing you did, Henry, so there you go. Hi, it's Richard Satur. I'm the CEO of D-Clinic. Today I'm going to be talking about one of our products. It's called VIC Rewards. We think it's transformative, and so we're going to tell you some really interesting things we've been doing with it, and I've got some big releases that I'll be chatting to you about. But otherwise, I'm saying hi all the way from Melbourne, Australia. where I am in serious lockdown. We are not allowed to go anywhere at all. And I gather that most of my company, which is a very large company now, is joining us, and a lot of our family and friends are joining us as well to say hi as well too. So there should be people from all around the world in lockdown watching us right now.
Oh, amazing. Welcome. Thank you, Richard, for that introduction. Great. So we all set now. So I'd have questions for our panel speakers today around health tech, investments, pivots. So my first question would be, so what are the recent investments that you've done in the space? I'd like to go for Henry first.
Sure. So we've been spending a lot, at least I've been spending a lot of time looking at a lot of different projects in the healthcare space. One of which I've been sort of in advanced stage. We haven't pulled the trigger yet. It's essentially measuring, it's somewhat like a telemedicine. It's a device that can clip to a mask that it can measure the airflows, whether it's inhale and exhale. Why is very exciting? Because if you look at, there are many tests that you can do for, seeing whether you have potentially getting infected, whether it's temperature, whether it's positive or negative tests. But I think airflow, it's certainly one of the key important areas, because at the end of the day, COVID affects the lungs. So if your lungs is affected, the measurement of the airflow, whether it's inhale and exhale, will be one of the key areas or earlier indicators to be affected. We're very excited about the project. Certainly, due to COVID, things are moving right along, but just like anything else, because of healthcare, things just taking longer than we expected. So we're in a very advanced stage of that. Hope to learn a little bit more about the project, hope to move a little bit of the project. But there are just so many projects out there that we're looking at, but this one in particular, I'm a little bit more excited about.
Okay, so in continuation with what I just asked you, so what does the new investment process look like during COVID-19?
Yeah, so I think once again, I think in the general environment I think VC dollars are still in abundance. Well, it depends. I think, for a lot of the bigger funds, they have been sort of raising capital the last couple of months. I think some of the micro funds are struggling a little bit. Micro funds, I'll probably term it, it's within the $100 million funds. So, it's a investment, it's a survivorship bias game. It's always the strongest or bigger brands survive typically. But a lot of my colleagues, the ones who haven't looked at healthcare, they're spending more and more time in healthcare. Not that, we'll just rush into the things. I think it just created a lot of opportunities. For myself, I typically look at things that I can try to understand. The company I talked to you about, it's something it's, for guys without a very heavy medical background, I can even look at it. I'll probably shy away from things like vaccines and drugs because, it's very difficult for me to compete with someone who like Richard, who has went through medical school and training for so long, and I don't pretend to be an expert in that area. But a lot of these medical equipment, analytics, PPE, things like that. These things are not hard to understand. I think if you have just a business mind, if you're just spending time looking at various different kinds of business model, there are a lot of those as well, and it's very, very exciting. I think it just, COVID certainly catalyzes things in terms of the space, healthcare in general, but I think the world in general. So there are a lot more eyeballs now, certainly, than I would say 6 months ago for people looking into healthcare.
Absolutely, I have to agree to that point. Thank you, Henry. Next, I'd like to go, Aga, with the same question. What are the recent investments that you've seen and the new process? What the investment process looks like post-COVID? COVID-19 during the pandemic, but right now.
Yeah, I think, so one of the businesses we're looking at is really, I would coin as probably still old school, as in remote monitoring and telemedicine. So, it has been around for a long time, but the pathway to commercialization has not been there, especially in Australia. So up until recently, the only way you could commercialize video consultation was through mental health. And the government had only allowed mental health practitioners to be able to do that because of the remoteness of the country. With COVID, however, the government and the Department of Health have realised that obviously people can't leave their homes, they can't leave areas, and therefore telemedicine is now a much larger part of the healthcare system. So they've now created pathways for practitioners to charge for their time over a teleconsultation. The reason we are in this space is obviously it's my background in terms of the company that I built and listed, but also we believe that remote monitoring is also plays a key part to patient care for a number of reasons, not just for COVID, but sustainability and scalability of the healthcare system all around Asia. So we are working with one particular company to see how we can expand their telehealth offering, and that includes more biometric measurements so that a practitioner can have all of that in front of them when they're meeting with them. So that could be from blood pressure to number of steps, activities, all those sorts of things, that we can build a much better picture for the patient and then triage the problem remotely. So, the majority of people don't actually need to attend to, an emergency department, but there is a high prevalence of that to happen in Australia. So changing the mind to say, if we can treat you at home and provide care at home is much better than having someone present at an emergency department, especially in the current climate where everyone is busy and hard pressed. So we're looking for companies that already have a business model and have an ability to scale that business model into other revenue streams. I think Henry is right. In this part of the world, there still is an abundance of investment money, and fortunately or unfortunately, health tech has been one of those places where people are looking at as a way of obviously an ROI on their investment. The difficulty is there is so much choice at the moment, and which one do you go for? So I'm a little bit like Henry as well. We try to understand the companies and the entrepreneurs and not try to get too technical, because it's well beyond our pay grade, right? So, however, in between very technical to the very basic, there is an abundance of investment opportunities out there, and it's a matter of going through and helping them out. I think the exciting thing for health tech here in Asia is that everything's been accelerated. So if you had a timeline or a time horizon of 5 or 10 years, that's now become 3 and 5, right? So there is more expectations on entrepreneurs to develop and build a business model, and I think there is funding to help support that. It is now, what part of the COVID value chain do you want to solve, I think is the more exciting things now. And so there's new things that are coming out all the time that we've just never saw before because of COVID. But because of that, it's a very, very exciting place to be in at the moment. And, while most things are locked down and things are done from home, we are very busy working with entrepreneurs and our ecosystem partners like universities, researchers, all these types of people, because it is really a busy time for us to try to solve these problems.
Excellent. I just want to add a point about the emergency services that you just mentioned. I haven't been recently after COVID-19, but I hear that the place looks totally different. Super busy, totally different, because obviously you have to cater more than before. Nice, good to know that. I got great points. Thank you. So next we have is Shamir.
So, to answer the first question, which is about investments in the space, plainly in healthcare tech, right? I think a lot of people tend to forget that solutions aren't just a technology solution, right? It's got to be backed by the scientific community. It has to have an understanding of, how healthcare really works. But it's quite interesting. So COVID-19 has really accelerated the adoption of a lot of these technologies and really pushed the boundaries. So we've seen a lot of startups really pivot some of their existing products and offerings to kind of cater to the current requirement of COVID-19. Internally as Accubits itself, we looked at, how we can actually help some of the existing customers that we're working with. And in light of that, we did something internally first to look at how we can safeguard our own employees, especially those working remotely, and to ensure that, we look at critical operations, if they're, able to work continuously, if we are under threat. So that came out as an internal product called Zero COVID. And later we started to work with some of the organizations, mainly at the government level. So we built something called Rebuild the Chain, which is a complete pandemic management system. And when we started doing that, it really came through that it wasn't just about COVID-19. So nations are worried about a lot of things. And although people talk about COVID-19 as a black swan event, it isn't a black swan. You can look at the data, and it's very clear that nations are expecting pandemics to happen almost every couple of years. And there's obviously a lot of investment in that regard to safeguard. But obviously, what this has literally shown is that we are definitely not ready for any of it. And it's literally a wake-up call for the healthcare system. And that's where companies like us and investments being made have a lot to do. So telemedicine, I think Aga had mentioned this, has really catapulted forward. I think the adoption has really come forth. Newer business models we're seeing today, especially with doctors, so there's an interesting project that we know of where we're basically capitalizing on home doctors, so a lot of female doctors, especially if you look at Pakistan, are currently at home and not really practicing. So there's an option now for them to go online and help with the, especially with diagnosing and understanding how they can help at least the first few cases through a completely online platform. So there's an amazing project, which is a nonprofit organization, which is doing that. There are other aspects of drug research as well, which is happening now. So we have a separate wing of Accubits, which is basically looking at advanced research, mainly on biological semiconductor research and some of the other stuff that we do. So interestingly, when this happened, we had to kind of reach out to a couple of practitioners in this space, mainly epidemiologists and virologists, to look at how we can help them from a technology perspective. So that's how we got into a potential molecule identification that's completely open sourced. And out of that is when we started looking at all of these other ingredients. So, when we started building this Rebuild the Chain, we looked at the entire spectrum of, where in the value chain does, a technology solution actually help, right? So there are a lot of other third-party components that would basically fit into it. And these are the investment areas that we are potentially interested in. So for instance, how could you look at, an oximeter? How could you look at other IoT devices for track and trace what could be done? So there are various components that we've looked at from a pandemic management perspective, going beyond just contact tracing, exposure and analysis, helping with quarantine management. And there's definitely areas for newer companies, newer startups to actually contribute.
So this pandemic management system that you just spoke about, so where did you launch this? I mean, is it already in operational?
It's live today, as in the platform is live. It's being adapted depending on the regional requirements of various nations. We're already in advanced stages in the state of Brazil to start with, and then into the remaining 25 states. Especially with a platform like this, privacy and security is of utmost concern. Which is why you have the PEP-PT protocol and the D3PT protocol. So right from the very start, when we started designing a platform like this, we had that in mind. And we're one of the very few which are already compliant with the GDPR norms. So that's where, technologies like blockchain really comes into play. So we're ensuring that, we're looking at pseudonymization of all the data that is being shared with a central platform like a government, or, making sure that the data is not used for any other purposes. and also making sure that you always have control on what data is actually being acquired and utilized.
Great. So the blockchain technology is actually a great help.
Absolutely, absolutely.
Thank you, Shamir. Thank you. So that brings to my next question. So what are the emerging products we see in the space? Like, probably wouldn't have thought about it before COVID-19, even though, we have some disaster, recovery services in place, if I just phrased it correctly. But what has emerged absolutely new during this time? Henry, would you like to take this question?
I think, at the forefront of things, I think, there's a race to find a vaccine for the cure. That's certainly in the forefront of things, because without the vaccine, this is the new normal. The new normal will be extended to however long there's a vaccine or multiple vaccines that will cure it. I think, as a result of this, we're all sort of in a lockdown mode or work from home. Telemedicine, it's coming to the forefront. As we were speaking, there's a very quick clip that come to my screen. It says the FDA in the States, it's open to home testing for COVID. I think before this, I don't think FDA will be sort of open to this. But if you sort of thinking about how I'm in the States here, I'm in New York City. Certainly, we were the epicenter of COVID-19 a few months ago, a lot better now. I think the governor here, Governor Cuomo, have done a wonderful job in terms of controlling the pandemics here in New York. But if you look at other parts of the country here, in particular, Florida, Texas, California, just to name a few, I mean, the number is just mind-boggling. And, when we think about telemedicine, that actually it's being bringing to the forefront of things also, because it's just simpler. I'll give you one very, very simple example. It's somewhat related question, but it's not. My mom, who hasn't seen a doctor for a while, she recently had her physical because things were opening back up. And after the physical, the doctor told her that you don't have to come in for the second visit, which is just getting the reports. I think something like this, it's not going to be a common practice prior to COVID, because now the doctor want to make sure that the patients would be sort of keeping social distance. They don't want to have too many people at the clinics or hospital. So, my mom had her sort of 15 or 20 minutes going over the reports at home with FaceTime with the doctor. When she was finished, she was like, wow, this is awesome. She said, I saved myself, a couple hours of time in terms of commuting. I saved myself a little bit of money from transportation. I love it. I'm loving it. So my mom, it's more at an advanced stage, and even she gets it. So I think, once again, COVID, I mean, we've been saying this, I've been saying this for a long time. You've been saying it, everyone's been saying it. I think it just catalyzes how certain things being done for hundreds, if not thousands of years. So it's very, very fascinating how we're changing human behavior as a result. Things that were kind of simple that we, can't be practiced before, but it wasn't an acceptable practice. Now it's just becoming a norm. So it just across the board, a lot of interesting things are happening. People are experimenting, and then people are loving it as a result. So it's kind of interesting how, it takes one event as such, changing how we live for most of us. In some ways, for better in that sense. So it's really interesting how we human we act to certain things and in our society.
Great. I mean, I really like that, like having a second consultation remotely. Who would have thought about it pre-COVID?
Yeah, so I'm gonna just a quick follow-up, and it's like kind of silly and crazy, right? So she was telling me, like, why did I for so many years have to go back for a second visit when I have to travel for a couple hours back and forth? Sometimes, I call it frictional time, just waiting for transportation. When you go to a clinic, sometimes you have to wait a little bit. There's a logjam in the office. Then you got to come back. Sometimes that appointment, you travel for so long, and then you wait for so long, you see the doctor for 15, 20 minutes. As something as simple, you can see it at home. So something as simple as such, may not be common practice. Maybe the doctor would not be compensated, from the healthcare system. But now it's like becoming a common practice. So once again, unfortunately, the COVID, it's not a good event that we have, but at the same time, we talked about this yesterday, there are actually a lot of benefits that came out of it. I think if we can look for the goods that happen in this pandemics, whenever we finish with COVID, when we look at this, I shared this with you yesterday, 5-10 years ago. I don't think it has to take that long if COVID can be contained in a couple of years. I think we'll look back at this major event as serve as a major catalyst for many things that we'll be doing in the future.
Totally agree with you. Totally. Thank you, Henry. I'll go with the same question. What are the emerging models, products, all during this time?
I think the big thing that is being front and center is our healthcare systems cannot continue the way they are. We've known this. In Australia, it's unsustainable. I think a report was done a couple of years ago that the quality of healthcare remained the same for 10 years, but the cost to deliver that was 10 times that. And we can't continue that. And in the current climate where the hospital beds are quite scarce and everyone is under pressure to do more. I think we've now realised how fragile our system is. And the one thing that can really fix this is technology. And I think this will allow us to have a much broader and deeper conversation about how technology can basically change the way we deliver healthcare around the world. We've used technology in every other industry, to better those industry, and unfortunately, healthcare has been one of the slowest adopters of technology. So I'm hoping that this has been a wake-up call for the administrators, for entrepreneurs that now can hopefully deliver great solutions through technology to make our healthcare system a lot more sustainable, and obviously not put the burdens back onto the state to have to deliver that, or the people that can't afford it. It just does not make sense. The one thing we don't talk about in this at the moment is healthcare affordability and availability to third world countries, right? So this is one of these things that, out of mind, out of sight, I think is crazy. We need to do more to be able to help people in these places. And one of the things is once again, is technology. So I just am hoping that if we take a positive from this, is that we come together and address that some of the way we do things is not working, and we should use this time to actually reevaluate how we deliver healthcare around the world, and build and come out of it, like Henry said, in a better place. There's some smart people there. There are people that have a desire to want to do this. There are people who desperately need this help. So I am hoping that this is a real wake-up call to have a rethink about how we deliver care.
Yeah, great points there, especially with the healthcare cost. Oh my God, I have to agree to that. The services pre-COVID remained the same. Nothing changed over years, but the costs were
crazy.
Crazy, yeah. Thank you. Next, we have Shamir for your thoughts.
So just to reiterate your question, it's about what newer technologies or what emerging tech you're seeing because of COVID.
Because of the situation, yes.
So like I said, I think COVID-19 has really pushed the boundaries for a lot of these companies, right? So what was seen as novel solutions are not novel anymore. It's the necessity, it's the need of the hour. And that has kind of accelerated development. So we know of a couple of our companies that we work with closely, especially in terms of microbiome research, that have actually had further funding and investment quite recently, because they have a lot to talk about, especially now. So it helps us to look at how we can protect humans from further diseases, and there's a direct correlation with outbreaks that have happened. Not just that, we're seeing other technology solutions that have come about. So we closely work with a disinfection tunnel solution out here in the UAE. And they've actually got patents for disinfection liquids that is able to kind of use an aerosol-based technology and really eliminate about 99% of these viruses. And the way they do that is quite interesting. So we have deep integrations that we're potentially looking at with such technologies to link up with, say, a digital passport, which could actually be, your digital identity card that holds your digital records and health statuses. Especially now that, we're seeing travel kind of open up and the borders open up, it's the need of the hour. Obviously, we need to look at how protocols are being enforced cross borders. We need to have similar protocols in place at both the destination and the origin. But I think it's essential and critical now that we have some sort of a mechanism that we can actually operate on. The aviation industry is one of the deeply hit industries. And obviously, there's an insurance associated with travel now that is directly related to these diseases. So it does make sense for tech companies to look at that sort of a solution and how we can actually safeguard travelers, ensure that the path on travel is safe, as well as when you reach your destination, you can actually prove that you're free from COVID. Earlier, we've seen the travel industry look at how they can actually enforce such protocols in place using quarantine. It was unimaginable earlier if you had to actually quarantine yourself for 14 days once you reach a destination. So today we're seeing newer technologies like laser scanning to actually do a initial test, and then if you do get positive, then you do a PCR test. So such technologies, I think, have advanced, and we're seeing newer things come up quite recently. And we're also seeing a lot of new advancements, especially in and around big data. Especially with vaccine research. So, today we have, a lot of open data sets. We're able to kind of understand trends. And since this is a constantly evolving space, especially with the mutations that we're seeing, there's a lot of newer data that is being generated as well. And this is where, such technologies can actually come to the forefront and help, the medical community.
Thank you. I really agree to those vaccination. I keep on reading, it keeps on popping up about, new vaccinations are going to come up soon, which is going to, get rid of COVID-19. Yeah, thank you so much for those insights, Shamir. So, okay, this brings to very swiftly to the next part of this session, where Richard Satur is going to do a keynote session. I really want all of us to, ask him questions. Sorry, Richard, is that okay if we can interrupt you in the first 5-10 minutes and ask questions? I really want this to be a two-way dialogue rather than one-way presentation, so that, I want everybody to be like, really listening to what he has got to say. Okay, Richard, the floor is all yours. You might have some questions from me as well. Please go ahead.
So look, I do have a presentation. I'm going to try and keep it to around 15-20 minutes because I do want to take as many questions as possible. But okay, as I'm presenting, I invite all of you to ask questions because I've listened intently to all of your comments, and I'm going to start off by saying I cannot agree more with all of you. I think you are all right. I think, one of the things that's really interested me, and it's funny enough, I'm going to do something a little bit different. Okay, so I've spent the last 3 years talking about what blockchain can do in healthcare. And in fact, my catch cry, by the way, with all the presentations I've done over the last 3 to 5 years or however long it's been on this particular topic, my catch cry is that healthcare needs blockchain. In fact, blockchain is healthcare's savior. In fact, I think some of the terminology I've used is that blockchain is healthcare's brave new world. Okay, and you are right. COVID has accelerated all of these things. COVID has created an environment where now anything is possible. Anything is possible because we know so little. What COVID has done is this little virus has suddenly brought about this absence of knowledge. And so now we have all of these companies and all of these people who are very smart companies and very smart people now starting to have a look at, well, what do we do next? How do we find this vaccine? How do we, and in the term that we can't find a vaccine, how do we create an environment where economies can still thrive, where, governments are not going under, where people can still associate with each other? We talked a little bit about mental health. One of the comments was around mental health in Australia and telemedicine being used for that initially. The reality is that I think we're going to be plagued with really substantial mental health problems through this COVID virus, where people are being isolated. And so I think we've got a whole stack of things. One of the things that people don't realize, and by the way, this is not scaremongering, but one of the things that people don't realize is that the last time we found a vaccine, the fastest we've ever come to a vaccine was, I think, and someone in the panel can correct me here if I'm wrong, and right off the top of my head, was it might have been polio, I think, and that vaccine took 5.5 years. Okay, so that's some scary numbers, and that's the fastest that mankind or humankind has come to finding a vaccine. Now, I stand to be corrected. You certainly can correct me, but I guess the point I'm trying to make is that this is a long road, okay? So what am I going to do different, okay? Blockchain, one of the best use cases for blockchain has been crypto. We all recognize that, okay? Then we went through this period where we separated the blockchain from crypto. We wanted blockchain to sit as its own technology because it had so much to offer, and crypto was this other thing that we didn't quite understand, but it kind of did really well, then it didn't do well, then it did really well, then it went up, then it went down. And so what I want to do today is I want to bring them back together again. I want to bridge the gap again, because I think, and this is now my, in the last year, this is what I've been professing at the conferences that I've gone to and spoken to, is that I think healthcare is the perfect use case for for crypto. I think, and the reason I say that is because if you really want transformative healthcare, if you really want healthcare to be so different and so transformative and so connected to the consumer, then crypto is a beautiful way of bringing it, because by using crypto to reward consumers, you actually bring them back to what is necessary for their own healthcare. And so what I want to do today is I want to talk a little bit about how we bring that nexus. How do we break that nexus? How do we bring it back together? Because bringing it back together is actually good in the healthcare space. It's particularly good, as a matter of fact. So that's what I'm going to talk a little bit about. So Sonny, can I just quickly share my screen? Is that all right?
Yeah, of course.
Okay, so I'm going to share my screen. Just let me know if I've shared it properly.
Yes.
Okay, so good.
Yes.
Okay.
Yeah.
So look, I at the moment, so first of all, I represent two companies. And when I say two companies, I mean D-Clinic is the company and VIC Rewards is the product. All right. So VIC Rewards is a product of D-Clinic. D-Clinic is a blockchain company. It's a healthcare blockchain company. Okay.
Yeah.
So why VIC Rewards? And as I said, I'm going to try and bring this together. Okay. So why now am I doing a big presentation around VIC Rewards? Well, D-Clinic has already been in the space of clinical development for 30 plus years for most of our staff. And by the way, for the, I was counting the number of people we have in D-Clinic, okay, that are associated to and work for D-Clinic, and it's actually over 90 people. And we are based out of Singapore with offices in Australia, in India, et cetera, et cetera. So we've been here doing this, and funnily enough, we've done a lot of this in Australia as well too. In fact, a lot of the team is Australian, and a lot of the development that's been going on in Australia, we've actually had our touch points with people from our company. So our company is an established company around clinical systems, around building clinical systems. And what we're really good at is behaving properly. In other words, we build with standards because we recognize all the things that you gentlemen talked about, security. One of the biggest problems with blockchain is poor when it comes to big data. So how do you solve that problem, for example? Now, we believe we have. So around security. Well, security could mean anything from Brazil to the US to Singapore to what does that mean? And then you've got regulatory, you've got consent models, etc. So the things that DClinic has been working on is very much in that area. So DClinic has built something called a private healthcare blockchain. But when we built it, we came to this conclusion there was a piece of the puzzle missing. And the piece of the puzzle that was missing was in fact this thing called VIC Rewards, which is what we're launching today. Not launching, sorry, we've launched it already, but what I want to talk today about, okay? So how do we engage with consumers? How do we, and by the way, you'll hear me use the word consumer, because for me, a consumer is only sometimes a patient, but we are all consumers of healthcare for our entire lives. We are always purchasing products and services in the healthcare space, regardless of whether we are well or not, or whether we're sick or not. So patient status is only moments in time. Now, some of those moments could be very long as we get more elderly and so forth, but the fact of the matter is we are consumers, okay? And so why VIC Rewards? What's the purpose of VIC Rewards, okay? So there are two things that I know. There are two things, and by the way, as I say this, feel free to ask me questions. If you disagree, I'm more than happy for the debate as well too, but there are two things that I know, okay? The first thing I know is that you are a consumer of healthcare products for your life. You will consume for the rest of your life, okay? The other thing I know is that you are only going to be a patient in moments of time. So whenever we think of healthcare, we shouldn't be thinking about that telemedicine consult as being that's healthcare. That's not healthcare. That's a moment in time that adds to your record, adds to your personal data, your personal healthcare data. And we need to start thinking more than that. We need to start thinking about our lifetimes as being consumers of this healthcare, of this thing called healthcare. So for me, what does healthcare actually mean, right? And interestingly, interestingly, all the speakers talked a little bit about this, you know. In fact, you talked about, Henry, you talked about your mother, right? They are all part of our healthcare. For me, healthcare is not about one interaction, it's about all interactions. For example, I believe, and when I say I'm now referring to my whole company, we believe that healthcare is also a part of your interactions with your own family. Your family can help you through your healthcare. If your family, for example, are part of your, your drive to do some walking, when you're actually allowed out during COVID times, I mean. But for example, if they are part of that journey, if they are part of the acceleration to your wellness and your vitality, then they become part of your healthcare plan. So for me, and for our company, it's about the holistic approach of healthcare. It's not about any one interaction, it's about all interactions. But when you start talking about interactions like these are complex. You know, if we talk just about x-rays, for example, that's huge data. You know, how do you cater for things like that and so forth? If we're talking about, if we're talking about just simple interactions, well, the number of those interactions could be so frequent that builds up to be big data. And then, of course, we never ever talk about the fact that patients can actually contribute to their own healthcare through things like feedback forms. So there's things called PROMs and PREMs and so forth. The idea being is that you can contribute back by giving information back to your care team. You are contributing back to your own healthcare. So when you start to look at a model like this and start thinking about the patient at the center of a more holistic journey through healthcare, then you could start to ask the question, well, why are you not being rewarded for this? If I can, and this is where I said, I'm going to bridge the gap here, okay? I'm going to bring blockchain and crypto back together, okay? Why are you not earning from your healthcare? Why are you not earning from your healthcare? Because I think that if you earn from your healthcare, I think you will want to do things that generate wellness and vitality as part of your life. So it's interesting. I can't remember which speaker. I think it might have been you, Samir, but you talked about technology, you know, and you are right. Part of the, actually, I think you might have mentioned that technology is such a big driver at the moment. You are absolutely right. But I think technology coupled with human behavior is how you solve the problem of healthcare. Because you're right, governments are going to go bankrupt. Governments cannot keep funding healthcare systems the way they do now. They can't do it. They will go bankrupt. So how do you bring it all together? And I think what you can do with crypto is bring it back to a utility case. You can bring crypto as part of the healthcare journey, and you can start to reward patients, and you can do it sustainably. And that's what we believe. And that's what VIC Rewards is. And that's what we have launched recently. And by the way, we are listing this. LAToken has been a phenomenal follower of ours. Sonny has been a huge advocate and has watched us over the last year and what we've done. And so we're going to launch this because we want to reward consumers. Again, I ask even the panel, if I rewarded you for your healthcare, I mean, really rewarded you with valuable utility tokens, I suspect you'd be interested. So I think if we can bring the technology and the crypto together, I think we've got a very sustainable model here. So you all look at your bank accounts. You all go look at your bank accounts now. You go check out how much money you have in your bank account. You see what you're spending your money on. Well, why can't we do exactly the same thing with healthcare? Why can't we create a crypto that actually has intrinsic value and is connected to your healthcare? In other words, why can't you view your healthcare the same way you view your bank account? Your bank account is healthy, you're happy. So if I can keep you interested in your healthcare, if we can keep you interested in your healthcare, then the chances are that you're going to have a journey that's going to bring you back to wellness, or you are going to have a palliative journey that is better than the one you would have had. So it could be either or. So our idea again is to reward the consumer. So do you want to earn from your own healthcare? I say definitely. Okay, but here's the interesting thing, right? It's not just me. We now have over 170,000 followers and it grows daily. When we launched this, we suddenly discovered that our videos, for example, are trending. Right? And by the way, I am being bullish about these numbers. Okay, it is a big sell because the reality is that consumers are sitting out there and they're saying, yeah, absolutely, this interests me. Why not? You know, I'm going to be a consumer of this stuff. Why can't I be paid for it? So what we're finding is that our following is telling us the same thing. They're saying, yeah, we want to be a part of this. So much so that over the last couple of years, we've been talking to a number of hedge funds and investor groups that have, really been having a look at how we've been bringing the technology and the utility token together. You know, they've not shied away from this. And so my big news for today is that Panzora did say yes, and Panzora is going to be a major investor in our VIC Rewards. Not only are they going to be, thank you very much. That was the big news, Sonny. Okay, I said it was coming. So prior to listing, we have been talking to a number of hedge funds. We've been talking to a number of investor groups, and we've been very particular, by the way. One of the reasons we really like Panzora is already quite heavily involved in health tech. They've already got a number of other clients that are starting to say, well, hang on a minute, why don't I inject a crypto into my business as well too? Because one of the things that we also want to do, so it's not just the fact that Panzora is investing and not the fact that their investment group is investing in us, but what they also bring to the table is all these other health tech companies that are also interested in participating with us. Because I mentioned that our coin needs to be, and by the way, I've now said the word coin as well too. So I've said, not only said blockchain and crypto, but I've now used the word coin as well too. And bullishly, I am saying that because what we want to do is create ecosystems. We want tradability. We want these things to happen. And I think healthcare, I'll come back to it again. I think healthcare is a perfect use case for it. Now, I do take note from the panel that things can go slowly. COVID has certainly accelerated all of this. There's no doubt about it. We're seeing this, that COVID is accelerating a lot of this, okay? But I will add one more thing to this, one more parameter to this, okay? not only do we have to say it, not only is DClinic and VIC Rewards parading the fact that this is good, what we are also going to do is we're going to demonstrate it. We have to do both, because we can't sit on the side of just technology and then say, oh, we'll let other people kind of develop it or implement it and all that. We can't do that. What we've got to do is we've got to take both sides of it and say, you know what? Not only are we going to develop the technology, but we're also going to demonstrate how this technology can be incredibly useful in the using the crypto space for rewards and loyalty in healthcare. So that's what we've decided to do. So that's why I called it a product of DClinic. DClinic is the blockchain technology company on the private healthcare blockchain, because of course, when you're talking about clinical data, you want something that's secure and so forth. And what VIC Rewards is the public side of this blockchain. It is the public blockchain that now goes about rewarding customers and rewarding care team members to participate in the ecosystems that DClinic is building with governments and organizations. That's the bridge. That's the way we bring it together. So what we want to do is we want everyone to benefit through our ecosystems, okay? Right. And you do that, sorry, did someone ask a question?
Anyone has any questions at this point?
Yeah, I do have one. So Rich, I just want to make sure, in case I missed it, can you maybe share your thoughts? How do you structure the token economics? How do you earn the vitality tokens? And how do you, I just want to make sure how are patients or consumer incentivized to earn these tokens? How do they use it? Just high level. I just want to understand the token economics.
Absolutely. So believe it or not, Henry, that's a fabulous segue to my next 3 slides. Thank you very much. Okay, so how do we incentivize? Well, the first thing is you have to incentivize everyone. You can't just incentivize consumers who are going to be patients. You have to incentivize everyone. You've got to incentivize the care teams, the organizations, the hospitals. And I know that's scary, but believe it or not, we can take them through this journey, and we are finding success stories with what we're doing in DClinic with a number of our organizations taking this on board. So how do you do it? Well, you've got to let consumers earn this. It's an earning potential, all right? And you've got to drive that home. It's an earning potential because consumers will get vitality. We also have created a market space where now they can use that VIC to actually buy products and services. Again, the utility, okay? You've got to, not only should they earn it, they should be able to use it. So we've got to create, again, the model is not just the technology, it's got to be the whole ecosystem. Governments, it's an easy sell. Consumers are consumers are healthy, you're going to reduce your healthcare costs. Demonstrable. Now, our partner in our journey in DClinic is Deloitte Southeast Asia. So what we do is we validate as we go through this process, and that's what we've been doing over the last few years. We've been validating this business model, and there is no doubt in our mind that the responses we've got from organizations and governments has been very positive. And you can go and see our success stories on our websites. So again, organizations can now properly track patient care. You've got merchants and organizations that can now explore new marketplaces. Interestingly enough, by the way, Henry, what we found is that organizations that participate in our ecosystem are now starting to look at crypto as a new delivery of business, a new model. And why not? Why not? So what they're doing is they're actually using what we've developed and saying, well, hang on, why can't we have a portion of this? And I'll give you an interesting one, Henry. All right, here's a really interesting one. Okay, clinical trials is a really interesting segue, if you want, for crypto from this space. There are so many interesting use cases that you can do. And once again, we've got some of that listed on our websites, but there's another really interesting element of this crypto space. You want also, if you're going to have people participate in this ecosystem, then you want them to be able to buy, trade, and sell. Okay, they should be able to do that. So, and I'm sure there are many more. So what I'm going to do is I'm going to jump over this slide because this was basically a summary of the last one, which is purchase products, trade. We have a yearly buyback option. I'm not going to spend too much time on that one. That's all available on the website. But this is what I wanted to show you, Henry, to answer your question. Okay. So one of the things we've started is we've started a marketplace. We actually have merchants in there selling products and services for a portion of both the VIC and for local currency. Okay. So once again, creating the value in that VIC. And what we're also doing, I will jump ahead, by the way, I will jump ahead because what I wanted to show you, sorry, I'm going to jump to another slide. Here you go. Okay. So here's a contract. Okay. Here's the actual mechanism of how this works. Okay. So here's a patient now in contract with their vitality professional. Okay. So a patient enters into a contract with a vitality patient. What is that? It's a smart contract. There you go. There's the bridge. So your bridge between your private healthcare blockchain, which is what you absolutely need for healthcare to satisfy security, regulatory, consent, big data, blah, 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 all there, done. What you've got on this other side is you've got a public blockchain, but what's the connection? How does this thing know what this thing is doing? Through the smart contract agreement. The smart contract agreement is a perfect way of bridging the gap between what happens in your private, in your clinical space, and in your consumer space. So the patient now walks 20 minutes a day. We'll reward them. But what we'll also do is we'll reward the care team member for preparing that and also monitoring it. Now, if we're going to do that, what's our incentive? So what we've spent over the last 2 years is coming up with a business model where it's a win for the merchants, it's a win for the organizations, it's a win for the consumers, and therefore by default, a win for governments. Okay. So, and the connection again is that smart contract. So what we've done is we've been working, sorry, this is the tagline, I want, I own, I use my VIC. By the way, go have everyone out there, go have a look at the videos. They are definitely trending. Every day I go and have a look. There's another 500 to 1,000 views on all of them. So clearly consumers are out there saying, why not? Why not? And hopefully you're gaining that through my excitement. Okay. So, sorry,
Sure.
Sonny, you want to ask me a question?
No. Go ahead, Richard.
Yeah, I'm gonna just make a quick comment. I think by being a panelist here, I think you should reward myself, Aga, and Shamir like 1,000 vitality tokens if these guys agree with me.
You know what? You know what, Henry?
I support you, Henry, 100%.
Absolutely.
Aha, you see?
Yeah.
Gentlemen are awesome, you guys.
Early adopters.
That's right.
I said, you know, if we can create value, right? Because, you know, the consumer out there, on a serious note, right? The consumer out there, you go to them and talk to them about blockchain. Go talk to them about blockchain. Most of them will look at you and go, what? I know the word because the word gets around a lot. I understand that. So how do we get them to participate in their own healthcare? Well, blockchain's the technology. We've got to incentivize them through their participation. Well, guess what? Participation, as far as I'm concerned, is one of the acronyms for blockchain anyway. So I think there is absolute reason and absolute business, and certainly, like I said, you know, for Panzora to come on board and be a major investor now, there is certainly absolute reason to bring the technology and the crypto together. So we are listening. Sorry, go ahead.
Richard, just a quick question. So I love the concept that after I go to CrossFit, I go for a run, you're going to credit my account with some Bitcoins. I love that concept. But from from technologists and the panels who are quite up to date with this, you know, with my experience within healthcare and aged care and that, the concept, how do you sell the concept to the end user? I understand that they would understand a reward mechanism. I think the difficulty I see, not difficulty is probably not the right word, is the education of what crypto coins are. What is a VIC coin, and what are the plans to I suppose educate the end user for that? Because, you know, having worked with a lot of elderly, you know, a lot of very simple assumptions that we had made do not transfer into the elderly. And I was quite curious to get your thoughts on, that education piece.
That's a superb question. That's an absolutely superb question. Okay. Have you seen the adoption of banking apps? How quick everyone picks up a banking app and very quickly knows how much money is in their account. Why? Because it's valuable. It's valuable. So my contention, and certainly, a lot of what we have done, remember that we are a company that started from pure clinical space, okay? We've been involved, and funnily enough, we have also been involved in aged care as well too. So in terms of the technology in those spaces, if we create an environment, and I mean an app, where they can see the earnings tick over, they will pick it up. They will pick it up. You have to, in my opinion, all you have to do is give them the mechanism by which they can see their profit from their healthcare. So the education, you are right. We could sit and we could talk about education. In fact, you could see at the moment in Melbourne, in Australia, Steve Bracks, who's our premier, he came back on this morning and gave a speech to everyone in Victoria and said, when you fall sick, why are you still going to work? Because you're just passing on COVID to all your work people. Now, there's a fairly simple kind of idea, so why are people not picking up that education, right? Why are they not being educated about that? And I think education is a big part of it. The reason I've used that is what I'm saying is show them through evidence. When you show through evidence, if I have an app, and by the way, we are talking about this being pervasive, that is the key here. But if I could show them an app, and when they do the right thing, they notice the number clicks up, they will get it. I think they will understand it very quickly. Look, I would challenge anyone, show me how many banks go out there and give education about how their apps work. They don't have to, because it's valuable, people pick up their app and go, I've got $100 in my bank account. It is that simple. So I think we drive it through the technology the portal we drive it through is what we call the web app portal.
Yeah. And will they store the value in their own wallets, Richard? What's the end custodian of the Bitcoin?
Absolutely. This is theirs to spend. Now, here's the thing, right? Now that they have that VIC, the next question is, what do I do with it? So again, we go back to the app. The app now gives them a marketplace and says, listen, go. And by the way, we can't just say you have a marketplace. We've got to demonstrate it's a real marketplace. So in August, for example, we've got half a dozen merchants with products coming on. And we've actually got a long queue of merchants ready to come on, because there are business models that very clearly show that the merchant can profit from this, the consumer can profit from this, and we can profit from this.
Yeah. Is the coin though held in a private wallet with the end user, or does it sit with you? Who is the custodian of the coin?
Yeah. So initially it'll be us, but eventually it'll be their private wallet. Yes, great question.
Okay.
Yeah, exactly. So
thank you. Any other questions from Shamir or Henry?
No, I think Aga had asked the same questions that I want to ask. So perfect.
Great. So everybody interested for the VIC coins now?
It sounds like you are. It sounds like what I have to do. I've actually got most of my company. I'm presuming most of my company are watching this, right? Because the Panzora news was breaking news. Okay, and by the way, that is hot off the press. Okay, there are a couple of other hedge funds that we're talking to at the moment, a couple of big investment houses, but Panzora is one that really interests us, right? But what I'm hoping that someone from my company is taking down names and numbers, and magically you'll have some VIC. But the point being is that, look, the fact that you asked for it means that we're generating the value. And that's really, I said I'm going to do something different. I'm going to bring the crypto and I'm going to bring the blockchain back together again, because this is a perfect use case for crypto.
Richard, just a personal one for me, being Singapore-based, have you applied for your PSA license here?
Yes.
Thank you.
All
Great.
covered.
Yeah.
All covered.
Yes, and we're listing soon.
Okay.
Okay. Of course, on LAToken, right?
Of course, Sonny. Of course.
More Bitcoin coming down your way, Sonny.
Well, the last, I think the last 3 or 4 presentations I've done has been very much around the blockchain, right? And building the case for the blockchain. COVID has now very conveniently done a lot of that for us. Thank you, COVID, right? From that perspective, obviously it's a very, the pandemic is nothing to be, frivolous about but the reality is it's built a lot of that traction now, which is really good for a lot of companies such as ourselves. But again, I think where a lot of companies can now benefit is going, okay, well, I've got this technology, I'm going to launch this technology, but you know what? If I can make it really demonstrably better for the consumer, in other words, start to look at it from a consumer's perspective, from a care team perspective, I think we will find that, that the engagement model is going to be better, and I think the uptake will be better.
Of course, I do agree with that. I think, I see a lot of enthusiastic faces. We can, catch up after this session. I think obviously we have a little way beyond our 1 hour time, but that's absolutely okay as long as everybody understands the concept and the utility of the Vitality coin, because we have so many questions. So we are good. I think, Richard, you can... Yeah.
Sonny, before I let everyone go, can I have everyone say, I want, I own, I use my VIC?
Please go ahead.
If you start sending coins to my wallet,
I want some for sure.
Thank you, Sonny.
So Richard, after this, I'm going to send you my wallet information. So we can, Sonny gets up for being the host. So.
Henry, I get that a lot. No, don't worry. You'll be hearing a lot about this.
Look forward to it.
So,
it's just Richard, I think, look, a great initiative, and I think it has potentially a lot of legs on that. I suppose in terms of the clinical side, where are you at in terms of onboarding partners and people, because you do need to build the marketplace, and I think that's very smart, and I think because if you have a marketplace for people to spend your coins, they will come. So I see that. But from a clinician point of view, where are you at? What are you targeting at? Is it low-hanging fruit, or are you going for the big raffles, hospitals initially? What are your plans from here?
Yeah, so both. The answer is both. So at the moment we're tackling a couple of governments, and you are right, by the way, the Australian government is a little bit slow in adopting, but it's also a small population. We are very much targeting the ASEAN region as our stepping on point, and India. So we are in negotiations at the moment. We've already won a really large contract. You can in Indonesia. You could read about that on our website. But we're also in very advanced negotiations with a number of states in India. And we're also talking to a number of other governments in the ASEAN region, because guess what? They will go bankrupt unless they do something. They have no choice. They cannot, this model of healthcare and funding healthcare is not sustainable. In terms of low-hanging fruit, we've got a huge number of clinicians that are now coming on board, and merchants. And a lot of it, funnily enough, we went from we started in Indonesia, and really through word of mouth and through an amazing team, by the way, that we have in Indonesia. We have a big presence in Indonesia, led by our managing director over there, Stephen. They have done some incredible initiatives over there. And so a lot of clinicians are now coming on board to actually be part of this ecosystem. But you're right, it's the ecosystem. We're just going to keep adding and adding and adding and making it more and more interesting. And each of these players, as they come on board, we're educating them about the fact that, you know what, your crypto can also have some great value in this ecosystem. So the education at that level comes really from us. But from a consumer level, give them an app, show them how they earn it. They're very excited. Sorry, Sonny, you're trying to tell me it's over.
The thing is, I just got told by my team that we've got another session to go.
Okay.
Thank you.
No rest for the wicked.
So I mean, everybody's telling me. I mean, yeah, Richard, they're telling me I want VIC. Exactly, I want
Fabulous.
VIC.
Fabulous. Well, they're
Yeah.
all going to get a chance to get VIC very soon on
Great.
LAToken.
Of course. So thank you for an amazing session today, Richard, introducing VIC Rewards to us, and also announcing the big news that you had. And thank you, Aga, Shamir, and Henry, for your contribution to this panel. And
Well, thank you for having us.
Yeah, I hope.
Thank you very much.
Something to take back, and we can build relationship, partnership with Richard after this, all of us. As a great project, as you can see, and he's covered in terms of the PSA Act that I got asked and everything else. So yeah, thank you, and goodbye till we see each other for maybe another session. Thank you.
Thanks, Sonny. Thanks, everyone.
Bye.
Thank
Take
you.
care.
Thanks,
Bye,
everyone.
everyone.
Take care.
Bye,
Bye, everyone.